Hello, my name is Rand Qasid Ahmed, Group 4, and supervised by Dr. Samar Burkan. Today I will be talking about a 35-year-old female patient reported with a complaint of burning sensation in the mouth for 1 month and multiple decayed teeth in the upper front tooth region for 6 months. Burning 1 month of burning sensation is really alarming and needs to be further investigated. Now, in history taking, the patient complained of burning sensation, dry mouth, and difficulty swallowing. Upon physical examination, pallor was noticed on the nail beds and the conjunctiva of the eye. Upon extraoral examination, the patient had bilateral crustation on the angle of the mouth, suggesting angular cheilitis. Now, intraoral examination. First of all, the patient had generalized pallor involving labial mucosa, buccal mucosa, palatal mucosa, and dorsal surface of the tongue. We also noticed that the salivary flow was diminished, indicated by sticking of mouth mirror on the tongue and the buccal mucosa, suggesting xerostomia. We also have depapillation of the tongue, and finally the patient had deeply carious teeth, which can be attributed to the dry mouth and diminished salivary flow. Now, when setting our differential diagnosis, we have three options to think about, which are iron deficiency anemia, Plummer-Vinson syndrome, and burning mouth syndrome. We are going to discuss each in details and relate them to our patient to reach our final diagnosis. Now, regarding iron deficiency anemia, patients present with red sore tip of tongue, and in long-standing cases we can see depapillation of the tongue. We can also see pallor, and angular cheilitis is also common. Going back to our patient had burning sensation, had depapillation, she also had pallor and angular cheilitis. All of these indicate that iron deficiency anemia is a good option to think about. Here you can see the depapillation and angular cheilitis as oral manifestations of iron deficiency anemia. Now, moving to the other option, or the second option, which is Plummer-Vinson syndrome. Now, quickly, Plummer-Vinson syndrome is a triad of dysphagia, glossitis, and iron deficiency anemia, accompanied by a burning sensation of tongue and oral mucosa, atrophy of lingual papillae. And now, women are at higher risk than men, particularly middle-aged women, and is a potentially malignant condition. Now, let's go back to our patient. Our patient had dysphagia. She also had glossitis. She has burning sensation, depapillation, and she is a woman who is in her 30s. So all of these indicate that our patient might have Plummer-Vinson syndrome. Now, moving to our third option, which was burning mouth syndrome. Now, burning mouth syndrome is characterized by daily burning sensation or persistent pain in the mouth, having clinically normal oral mucosa. After excluding the other local and systemic diseases, the most common site is the tongue. It is usually idiopathic or of a neurological origin and is associated with chronic orofacial pain and disturbance in oral sensation. We have no identifiable precipitating factor, and it can be related to depression, mood swings, anxiety, and emotional instability. So here you can see that in order to diagnose a patient primarily with burning mouth syndrome, we need to exclude any other precipitating factor that can lead to a burning sensation. Now let's go back to our patient. Further investigations were done, complete blood count was requested, and hemoglobin percentage was very low, 6.4%. Red blood cells count, red cell indices, and hematocrit were also low, and this led us to our final diagnosis, which was burning mouth syndrome secondary to iron deficiency anemia. So it's clear that the patient had a nutritional deficiency, which is iron deficiency anemia, that led to her having also a burning mouth syndrome that is secondary to this deficiency. Now to revise the burning mouth syndrome, we have two types. Primary type, which is idiopathic or neurological. Secondary, that can be secondary to literally anything, including dry mouth, other oral conditions, infections, fungal infections, nutritional deficiencies, as in our case, dentures, especially poor fitting ones, allergies, certain medications, endocrine disorders, or psychological factors. Now, in our case, our patient had a nutritional deficiency, which was iron deficiency anemia, that led to the burning mouth syndrome, the secondary burning mouth syndrome. Now, the most commonly involved sites are the tongue, lips, and oral mucosa. It is often accompanied by xerostomia, resulting in multiple carious teeth. برضو, as in our patient, she had xerostomia and multiple carious teeth. The pain is often spontaneous, and we also need to give attention to the psychological component. This is it for today. Thank you, Dr. Samar, for all your efforts. I hope that I did well. Thank you again.